We've heard from Elio that you went back a very long way to the 1970s. And now I have the challenge of saying, why has it taken old men like me to come up with a recognition that fruit and vegetables are good for you? Well, let me take you back, not to 1970, to the time of my grandparents. Does this work? And this is what I had to present to the ministers of agriculture and health in Vienna in the Opera House about 30 years ago. And I said, if you look on the top left, these are the traditional agricultural zones of Europe. And this was the traditional method of farming. And everything was local. You think about world trade, forget about it. It was minute. People ate what they could grow. And if you come from Norway, there are certain things you can't grow which you can in the Mediterranean. Everybody understands that. But they don't understand the health consequences. And actually, early this century, there were studies on why the children of poor people were short. And this is the first randomized controlled trial of feeding these children extra food. And on the left, you see that the biggest column is where they add milk. And up goes the height. And on the right, in the yellow, you see the weight. And what's good for your weight is not only milk, but butter and sugar. So they began to, and there were American studies as well, showing that meat was an extremely good way of increasing height of poor children. So it was not genetic, it was diet and the environment. And so we came to a part where, for the first part of the last century, we were talking about the wonders of vitamins. But suddenly we realized that we'd been missing things. It wasn't just vitamin C and later on vitamin A and D. It was a question of meat, so, protein, and animal protein in particular. And if you're going to survive the Second World War, whatever country you are in Europe, it suddenly became a crisis point because you had to grow your own food. And meat, butter, oil, sugars, and fats were the wonderful way of giving people enough energy to work. And of course, you have to have a little bit of fruit or vegetables or something for these vitamins. But, the important thing is, as I went to school, you won't believe this, that was what we ate in school, special school lunches, a complete new development. And we had to have 1 spoon of top on the left, cod liver oil. Terrible stuff. Absolutely terrible. And then we had to drink a third of a pint, so that's about 175 mils of milk, full cream milk. And then we had this funny stuff that came from somewhere abroad called orange juice, which tasted quite nice. So that was our new recipe. And the health, this was in the UK, improved dramatically during the Second World War. In fact, the death rate went down despite the casualties at home from the war. So that was obvious. We now have discovered what's important for health. Meat, fat, butter, milk, and a few bits of fruit and vegetable. Look, we don't want to get scurvy. So we therefore need to transform agriculture. We need to produce animals at enormous production rates. And we need to get the agriculture working so that it is not like this old, stupid, little local farmer, local food. We've really got to get organized. And so I decided not to give you the old data, on European subsidies. But after the war, Germany was starving. France was in a terrible state. And in fact, the question was, I interviewed the general for the British Army at my institute, where he had 7 million starving Western Europeans in French and German territories. And how to feed them and 7 million starving people in the Middle East was a big crisis. So agriculture, rural development was the key for Germany and France. And since the Second World War, we put in billions of euros. I mean, billions. And America, they actually gave the British a prize in agriculture and in public health for discovering these incredible ingredients in food. So the US, for the last 70 years, has had huge subsidies. Still 20 billion direct, and look at that, 170 billion indirect price manipulation. And Europe used to have 97% of all European funding was in agriculture. And now it's changing, but you're still putting in a few billion, and indeed 14 billion now for rural development, because they've suddenly discovered there's something called the environment. But we have actually lived through a complete manipulation of the food chain since the Second World War, based on, and this applies throughout the world, based on those experiments in the United States and in the UK before and during the war. And if you don't understand that, you won't understand why we're in such a mess. So, we realized we were in a bit of a mess when these crazy Norwegians, whom you heard this morning, actually started measuring things and realized that people were dying suddenly in early middle age from this new disease that my father-in-law, who was a young doctor, they rushed up to the ward to see this first thing that they called a heart attack. They'd never seen it before. And when I was a young doctor, the heart attacks were just everywhere. And I'd go into a ward and a man of 35 would suddenly be found dead the next morning in his bed. And this was the crisis. And Norway was the first country to say, we've got this wrong, and in 1962, intervened with national policies affecting agriculture and health, society, and economics, and so on. And look at the drop in the death rate already. But then, how did that come? It came from the so-called 7-country study, including Japan, Northern Europe, and Southern Europe, and the United States. And this is now a very much neglected study, but Kromhout, in the last few weeks, has just published a reanalysis with new, updated mathematics on the chemical analyses, which were redone on those original foods. And of course, the lowest death rate was in Japan and down in the bottom left in Crete, in Greece. And then you come to Italy and Macedonia and Serbia and so on. And then at the top is Finland and Western and Eastern Finland, United States, Belgium, and Holland. And this is related to saturated fat. Don't believe everything you heard about sugar. So that is actually still, as Elio described, the most spectacular improvements in public health over the last 40 years. But please understand that although those studies were coming out in the 1950s, early 60s, it was not till 1982 that WHO was able to get to the point politically of being able to establish what are the causes of this epidemic, the mass epidemic affecting the world. And they said that it's smoking, high blood pressure, and high cholesterol levels. And they looked at it and said, how do we manipulate this? And they needed to drop the total fat Sugar was regarded as an irrelevant thing you don't need. Saturated fat, they had to drop. In the Northern Europe and the United States, the UK, Finland, it was over 20%. So they dramatically said it should be half that. So that's why they manipulated the fat down. But if you read this stuff carefully, and I was responsible with Jeffrey Rose just after this for trying to implement this across the globe. Diets primarily of complex carbohydrates deriving from, what's this, vegetables and fruit? We were working on fiber at the time, and Jeffrey knew this, and he said, oh, there's something about fiber that's good for you. So actually we need more of this instead of fats and sugar and so on. Didn't talk about meat. And he also put in there, 1982, the prevention of obesity, because that made everything worse. But he also did something very strange, and bear with me. The dotted line going up, can you just see it? As it goes up to the right, is the increased risk of death rates for every increase in cholesterol levels. And then in the blue blocks, it's where in the population is your cholesterol. And you notice that very few are in the high range, the high risk group. And the average is bang in the middle there. But if you calculate how many people's lives you will save by putting everybody into the bottom category, lowest risk, you save 4 times, 11 instead of 3 per thousand. Nearly 4 times as many by changing the average, not just the high risk. And this is why WHO and the medical profession have not seen eye to eye for quite a long time. Because WHO is saying you've got to shift the whole of the population to save more lives. And we as doctors were trained, you know, you look for a high risk and then you treat that patient. Well, of course, it's medically important, but in public health, it's getting the average change. Now, you have to also recognize that if you give people exactly the same diet, you get different responses. So if you go right across the bottom axis, I'm going to double your saturated fat index, and up goes your cholesterol level, sometimes a small bit, and sometimes 5 times more. So we have individuals who respond a lot, even on the same diet, and you also have a lot of people with different dietary intakes. So doctors know that they measure the cholesterol, and they need to reduce the saturated fat. But those cholesterol people may be on quite a modest average diet for the stupid diet in the UK, but all those patients need to come down as well as the high-risk group. And it applies to dietary cholesterol as well. So, what I've described is suddenly a new way of medical thinking. But at the same time, in the early 1980s, the same time that Jeffrey Rose, suddenly, and I was involved with the food industry, they understood that actually if they studied people cleverly, they could work out how to influence them. How do you influence them? You tell everybody that everybody who's sensible is eating meat. It's good for you, it makes children grow, it gives you iron, and if you're very sophisticated, it gives you more zinc. I mean, it's fantastic. And you have the price, and you manipulate the price, and you make food everywhere available. So that's how a dramatic change in food consumption occurred from the 1980s onwards. Can I change on to the next? Yes. And if you think I'm just making this up about the 1980s, let's take obesity on the left and go back with identical measurements in populations in Australia, where they did analyses back 100 years. And the childhood obesity increases a very little bit, But early 1980, it takes off like a rocket. Every country in Western Europe and the Western world took off in early 1980. In the developing world, 85 or 90. Why? Because the marketing hadn't got there yet. Oh, and can I go back? No. On the right, I showed that this is an epidemic that's affecting everybody. So this was starting in 1980, but we'd only just discovered that we need to do something about fat. But we sophisticated Europeans, we knew we had to be cleverer. So a few of us decided with WHO Europe to try to look at this as an integrated way. And, even then we had to go on the basis of evidence. So what did we do? We agreed that we're dealing with population, but we also have to keep the medical profession happy and say, of course, you've got to deal with high-risk groups. But then we have a list of different things. Complex carbohydrates, we could agree. Fiber, we could agree. And all these other things. You see there's no fruit and vegetables. Why? Because, I actually thought, I wrote 99.5% of this report with the help of my people, my friends and co-authors who said, that's rubbish, or we need to change something. But we knew the Mediterranean diet was fantastic. But why is that? Is it just low saturated fat? Is there something else? This is all we could come up with. And so WHO in Geneva got jealous as Europe started working. And so they asked me to come and remember the Soviet Republic of the Soviet Union was in charge, Grabauskas from Lithuania, and he said, Phil, we've got to do this for the whole world. So we continued the principle of trying to shift averages, and we then had to take on the whole world. But we hardly knew at that stage what we were talking about, except we knew about the classic studies, and there were some studies. But we knew somehow that we were talking about antioxidants and so on, and some fruit and vegetable. Mediterranean countries, everybody, I was getting bored with sometimes the French, but certainly the Italians, not Elio, fortunately, and the Greeks, they were always telling me the Mediterranean diet is perfect. So we said, okay, how can we work it out? And we didn't have the evidence except for fiber. And here on the left is the effect in a metabolic studies in Cambridge, as Elio described, where we actually spent, in current day terms, 10 to 15 million euros, at least we didn't spend it, Unilever did. And we extracted fields and snap froze vegetables, then had them distilled in perfume refineries to get the fiber alone and fed it exactly. And you see there, carrot and cabbage as well as bran. Up goes the fecal output, the weight of the stools. And we could at least say that that's important because it prevents constipation. So how do we work it out? And I said, look, let's look at this Mediterranean diet. And Anna Ferluzzi got this data from the 1930s and 60s. And it was household. It was not the middle-aged men of the 7 country studies. It was household. Beautifully done. 400 grams. And we worked backwards overnight on the telephone with John Cummings in Cambridge. And we said, okay, that looks about right. That's how we made policy in those days. And we knew that we needed to think about the world. And it's a big place with incredibly different diets. So we had a lower population average and a higher population average. And this diet was strongly opposed by the United States. Why? Because I said, we don't need any saturated fat, biologically. We don't need any dietary cholesterol, logically. And we don't need any sugar. It's not essential to life. And we got absolute I mean, we had to try and revise our report. No, we didn't. It was taken to the Executive Council, taken to the World Health Assembly. And as in the most recent report on sugar, it was the United States and actually Italy, the chocolate manufacturers, who opposed this. So in fact, we came up with a policy which was really quite new, with their vegetables and fruit for the first time, 400 grams, 5 portions in US terms, 80 grams per portion. That's how it came. That's 1990. We actually showed, and this was the fat question, we knew that it could be down to 15, but everybody in the States said, oh, no, it has to be 30 or something. But actually, if there's the best studies ever done in the world in Brazil, and meticulous weighed intakes of hundreds of thousands of households, measured directly with people in the home, and the diets can change. The critical thing is what's in the food. And that was very illuminating. So how can we separate out the actual effects of vegetables? And lo and behold, we then, following these studies, began to get real data from beautiful, meticulous metabolic studies showing that if you add 400 grams, why? Because that's what we come up with. These are United States studies. You drop the blood pressure, which was known to be one of the biggest risk factors in the world. People in the third world, as we called it, were dying of strokes from very high blood pressure. You have to drop the salt, up the fruit and vegetables, drop the fat. And this is the effect. Very clear. People have forgotten, but it's true. So by the last report, really, that's integrated is 2003, where I was the enemy. I was on the committee, but was not allowed to write a single word, because otherwise the United States would say it was prejudiced in favor of health and the public, not in favor of the American, whatever it is, food industry. And here they'd now got convincing evidence that it prevented heart disease and so on. So in fact, we were making progress. And Gro Harlem Brundtland took it to Rome and presented it. And they said, you've got to do this because it's a new way of looking at food and agriculture. Because we'd already, 10 years previously, said it's agriculture that's got to change. And it was thrown out by 140 ministers of agriculture across the world as complete rubbish, and FAO was banned in 2003 from doing anything on this. 2003, only 15 years ago. Why? Because they'd had a brilliant success from all this subsidy. The price of these commodities, fats and meat and so on, had come down enormously. But actually, although the price of sugar and fat and meat had come down, look on the left of there, the price of fruit and sugar, fruit and vegetables had gone up, relatively speaking. In other words, no subsidies, very few subsidies, are being put into fruit and vegetables. All are being put into meat, oils, fats, and sugars. What do you expect? And actually, people respond to price. And here's a classic study from close here in front from Marseille, showing that actually, you know, the things that are cheap and packed with energy, top left, are very cheap, fats and so on, and fruit and vegetables are the most expensive. That's the problem. And it's a consequence of our industrial strategy based on public health grounds 70 years ago, please remember. By 10 years ago, FAO was suddenly realizing that cattle rearing and so on is actually having a big impact on the environment. And they actually spelt it out in great detail. But frankly, the ministers of agriculture couldn't really cope with this. And at the same time, we were getting from the World Cancer Report, Research Fund, increasing evidence that fruit and vegetables, for various reasons, potentially valid, very difficult to do these studies, in a whole range of cancers. So we were having a conflict between public health and agriculture. And FAO kept saying, well, we respond to what people need. So they prophesied a vast increase in meat and oil and sugar consumption and production. The exact opposite of what we told, and they'd agreed to in theory, but not the ministers, in 2003. So if you look at it, we were in a mess. And we tried to actually introduce, with Al Alwen having a major role, a summit in the United Nations on NCDs. And I went and talked to the 16 prime ministers of the Trinidad, and then it was taken to the British Commonwealth, 53 countries, and the UN Economic, and so on and so forth. Moscow, and we went through the whole thing. And in Moscow, I had to present to nearly 200 ministers of health the evidence. Now you see in green the mechanisms whereby these killers are being affected. And we know the evidence. But they looked at this as though they'd never heard of it before. But now I think I want to finish on an optimistic note. Because I've told you that there's this fundamental inability to cope with the challenge of what we set out to do 70 years ago, where we got it wrong. And the question is, what's going to change? And I think that the biggest change that's happening is this sustainable diet, environmental, planetary survival question. And I think we heard this morning about the Sustainable Development Goals. That's where we're going to get, because there's been so much pressure from the environmentalists. So in public health, please, and doctors, Wonka, don't forget the environmentalists who can help you getting across not only an economic argument, but a political imperative as well. So in conclusion, we've come a very long way. We thought it was based on health education, but actually the drivers have been economic and political. And health education takes you some way, but actually we need to have an integrated approach to the food chain policies affecting agriculture, the food industry, and what we do as doctors. And governments need to price and control. And the French, after we put this, the French government instituted, just about more than 10 years ago, a French school initiative, which was the first in the world. And we need to think in an integrated way, because otherwise we're going to be wasting a lot of time treating patients for preventable disease. Thank you very much.